Hey everyone, today I'm going to be going through critical question 2, which is how does sports medicine address the demands of specific athletes? So today, in the terms of specific athletes, we'll be looking at adult and aged athletes. In particular, we'll be looking at heart conditions, fractures/bone density, flexibility/joint mobility. So first off, why do adults and aged athletes need exercise? Well, exercise is kind of essential because as people age, they need to take exercise regularly in order to maintain aerobic endurance. Aerobic basically means something which is for a long period of time and when it uses oxygen, when oxygen is present. Reduction of lifestyle diseases, for example, is diabetes and CVD. You need to have this as you age because they're more prevalent as you age, and hence exercise is a way of decreasing these lifestyle diseases. Additionally, by doing exercise, adults and aged athletes promote healthy living. The next thing is I wanted to ask the question, what are some examples of activities that they can undertake? Because in sports medicine, every single type of athlete has different things that they have to do in terms of sports medicine in order to maintain a healthy lifestyle. So for adults and aging athletes, most programs must be low intensity, and they should gradually increase from, moderate intensity, gradually increase to moderate intensities. So from low intensity to moderate intensity, but it should be a gradual increase. Moderate intensity being the maximum. So some examples would be walking, cycling, swimming, light resistance training, yoga, Pilates, group exercise sessions. And then the next question, I've just completely reiterated it. I've said what intensity should the exercises be, and just to try and get this into your head, the intensity should be low to medium. Okay, so moving on, we have the three things that we need to look into: the heart conditions, fractures and bone density, as well as flexibility and joint mobility. So what are heart conditions? Heart conditions are just anything which include diseases such as CVD, or suppose even a heart condition can be considered as someone who has had a heart attack and has had a surgery. They must have a condition in their heart which is, causing these things. That can be considered a heart condition. Arteriosclerosis, which is another one. And then you obviously have CVD, which stands for cardiovascular disease. And the other thing is that this disease, cardiovascular disease, is common in adult and aging athletes, and it's usually because of genetic or lifestyle choices. Okay, so who are at risk? Anyone with a personal or family history of CVD, because it is sometimes genetically passed on, and anyone with risk factors leading up to CVD, which means health factors. Lifestyle behaviors. This would include, having unhealthy food, not exercising at all, just not following healthy guidelines in intake, and not actually meeting up to your part of staying fit. And this is often in people who are sedentary, which means that they are not moving and they are not active. They are most likely to get CVD, and as you age, you are more susceptible to getting CVD anyways. So going on, anyone who has recent surgery to the heart is also susceptible to CVD. So you might ask, what's the relation to sports medicine? Because this entire topic is sports medicine. We need to know in context to sports medicine. Well, the relation is that there are certain things that you need to do in order to make sure that you're meeting up to the requirements of these type of athletes. And some of these requirements need to be met up by these following ways. So this could be done through, pre-exercise questionnaires to make sure that the athlete doesn't have any past conditions which are related to heart conditions. You could have stress tests and history tests, checks, which can be completed by just checking up with a doctor, making sure that the person hasn't had any past heart conditions, and also making sure you have a qualified trainer who knows what he or she is doing, as well as having sessions no longer than 30 to 45 minutes and maximum of 3 to 4 times per week. And also, as we said before, only making sure that they are light resistance training. Okay, so now we move on to the next part, which is fractures and bone density. So fractures and bone density, they refer to the strength of bones and injuries which can potentially fracture a bone. As people age, their bones become less dense and more fragile. So factors such as low calcium intake earlier in life, insufficient resistance training, activity levels, and osteoporosis increase the likelihood of bone fractures. Now, if you don't know what osteoporosis are those people who have been born with really, really weak bones. And you might have heard about someone with osteoporosis breaking a bone up to like 30 times. I know someone with osteoporosis who has broken his arm numerous times, and it's just been to a point where he can't even feel the pain anymore. It's a very, very, difficult disease to deal with, and it is very, very dangerous because you can't actually do many sports easily. And all these things, they increase the likelihood of bone fractures. So who are at risk and why? As the topic states, it's anyone like who are adults and age athletes, because obviously it is more prevalent there. But I've stated earlier that anyone with low calcium intakes earlier in life, people who do minimal strength training, those with osteoporosis, and those who do not sustain regular physical activity. Once again, what relation does this have to sports medicine? Well, in order to ensure a good health, load-bearing exercises such as light resistance training, cycling, walking, as well as recreational exercises such as gardening would be beneficial. And by the way, by taking the doctor's advice beforehand, that would also be really good, just to make sure that they are all clean, all ready to go for the exercises that they're willing to do. And the last bit that we need to cover was flexibility and joint mobility. So flexibility is the measure of how far muscle fibers can be stretched in the body. Often it gradually decreases as people age, and usually leads to muscle tightness, joint stiffness, as well as the inability to perform everyday tasks. And people who are at risk, obviously, for this, relating back to the topic, it's adults and aging athletes, which are vulnerable to having a lower flexibility, so basically meaning that they are most likely to have a lower flexibility, because they are more prone as they grow up to have a lower flexibility. And lastly, our relation to sports medicine was that basically all physical activity aids joint mobility as well as flexibility. To make sure that flexibility is maintained, we should have light stretching exercises, as well as just the common exercise is going to help you maintain flexibility in some sort of a way. So it's really important that flexibility and joint mobility get maintained. Well, some examples to actually maintain this would be, doing yoga, Pilates, as well as just doing regular stretching. And all of these will either increase strength or flexibility as well as balance and coordination. So overall, that's how you can maintain this through sports medicine. That should cover it all, and thank you for watching.